In this video, we will explore the important strategies in OET writing. All right, doctors, let's break down the biggest secrets of OET writing, the strategies that literally make or break your score. And don't worry, I'm going to explain this in the simplest, most practical, most you can use it today kind of way. Okay, let's go. The first one is use your 5-minute reading time wisely. Look, those first 5 minutes are gold. Most students waste this time by reading every single case note like a storybook. Please don't do that. Instead, do in this way. You have to first look at who you are writing to, next, understand what they need from you, and finally, check your role. Once this is clear, your brain automatically knows which case notes matter and which ones don't. It's like setting your GPS before you start driving. Everything becomes easier and faster. Next one, select only relevant case notes. This is the rule students forget the most. OET doesn't give you marks for copying everything. OET gives you marks for choosing the right information. So anytime you look at a case note, ask yourself two magic questions. Does the reader need this? Will this detail change patient care? If the answer is no for both, leave it out. Simple, clean, professional. Exactly how real clinicians communicate. And adapt based on the reader, role plus purpose. This is where real strategy comes in. Think about it. You would talk differently to a cardiologist, a physiotherapist, a community nurse, an emergency consultant, right? They all have different responsibilities, different priorities, and different follow up tasks. So, your job is to shape the letter based on who they are, what they need to do next. That's it. Once you do this, your writing becomes relevant, sharp, and exam ready. And write clear introductions. Please don't overcomplicate this part. Your introduction should answer only two things: who you are writing about, why you are writing. Example, I'm writing to refer Mr. Thomas who presented with worsening chest pain. That's it. No storytelling, no drama, straight, clean, professional. And structure logically. This is the best formula. Think of your letter like a clinical handover. It follows a simple flow: the introduction, background, current situation, and the request. Let me break that down. The first one, introduction, that means your purpose. Background, yes, essential medical history. Current situation, any symptoms for today, or current symptoms, or investigations, treatments, and request what you want the reader to do. So, this flow helps your reader understand the situation instantly, even if they are reading the letter quickly during a busy shift. Okay? And analyze sample letters the smart way. Most students read sample letters the wrong way. They copy the structure, they copy the phrases, but they never ask why those choices were made. A good student asks, oh, the writer included this because the cardiologist needs it. They did not include that because it's irrelevant. They wrote the introduction like this because it highlights urgency. So once you start analyzing samples like this, not copying but understanding, then your writing improves faster than ever. Okay, now let's look at a sample task. Using the information given in the case notes, write a letter of referral to Dr. Anish Verma, cardiologist, regarding Mr. Ryan Thomas, a 58-year-old patient presenting with exertional chest pain and shortness of breath. And let me move on to the case notes. Here are the case notes. Name Mr. Ryan Thomas, age 58, background HDN, hyperlipidemia, smoker for about 20 years, overweight. Presenting problems are chest pain during climbing stairs, 3 episodes in last week, pain radiates to left arm, shortness of breath plus sweating, investigations, BP range they have given, ECG, ST segment depression, troponin normal, management aspirin 300 mg, oxygen therapy, advised urgent cardiology review. Planners refer to cardiologists for further evaluation, stress test, and angiogram. So for this, how are you going to write the letter? Now, this is my letter response. I've given the date, Dr. Anish Verma, consultant cardiologist, City Heart Center, regarding Mr. Ryan Thomas, 58-year-old. Dear Dr. Verma, I'm writing to refer Mr. Ryan Thomas, who presented today with exertional chest pain associated with shortness of breath and diaphoresis. Over the past week, Mr. Thomas has experienced 3 episodes of chest pain while climbing stairs. The pain radiates to his left arm and resolves with rest. On arrival, his blood pressure was elevated at 158 per 96 mmHg and the ECG showed ST segment depression. Troponin levels were within normal limits. Mr. Thomas has a past medical history of hypertension, hyperlipidemia. He is overweight and has been smoking for 20 years. Before transfer, he was administered 300 mg aspirin and oxygen therapy, which provided some relief. Given his symptoms and risk factors, further cardiology assessment, including a possible stress test and angiography, is required. I would appreciate your urgent evaluation and management of his condition. Please feel free to contact me for any additional information. And sincerely, you can write your name and your designation too. Okay, so now let me tell you how this letter matches the method I taught you. The part 1, it stated the clear purpose. I'm writing to refer Mr. Ryan Thomas, who presented today with exertional chest pain, so and so. So here, this one is very straightforward. No drama, no fancy English. Immediately, I have stated who and why. Exactly the formula that we have discussed. And if you see the second part, okay, the fast 3-part case note selection. I have selected only the important things. The trigger event, chest pain on exertion, and key symptoms, the key symptoms, the radiation to left arm, sweating, shortness of breath, all these things. And what the reader must do here, they have to evaluate urgently, consider the stress test or angiogram. Okay, so remember, don't be a photocopy machine. Remember that. Pick only what matters. No childhood history, no random case, no data, only clinically relevant details you're going to pick up. Okay, and if you see the body paragraph, it's professional and it's not robotic. What the structure I have followed here is what happened first. Like I have mentioned about the episodes of chest pain during stairs, right? And what has changed? Pattern repeated 3 times. That means the frequency I have mentioned. And what I have done? Administered 300 mg aspirin, oxygen therapy. And what I need from the reader now? Urgent cardiology evaluation. Clear, right? So this exactly tells another clinician what is required and what is the purpose. And the closing line is very simple, not overthinking. Please feel free to contact me for any additional information. So this is very simple, professional, no flowery sentences. And remember the secret skill, choosing, not copying. You have noticed, right, that I did not include his vaccination history, his mother's diabetes, his hobbies, his old hospital visits because they are not relevant to the cardiologist's decision making. This directly applies the rule you score for choosing, not for copying everything. Okay? Okay, so that's all for today's video. Kindly like, share, and subscribe for more OET tips. See you in the next video. Bye bye.